is Vanessa. Welcome to OrthoRefresh. This video reviews how to apply a posterior slab and stirrup components for a short leg splint for a pediatric patient. This will be appropriate for tibia fractures or other ankle pathology. Enjoy. Rolls of plaster, 3 to 4 inch padding, tape, elastic bandage, and scissors. There are options for positioning the patient. First option would be to have them sit on an exam table with leg hanging over. The second option would be to have the patient lay supine with someone helping you hold the leg bent. And the third option is to have the patient lay prone, which is demonstrated in this video. Ideally, have the patient lay prone and then use a towel to cover their upper legs. Begin by creating a foot strip accordion fold with the padding. You may use a stockinette first, but for this video, we will skip the stockinette and start with the padding. Have the patient's knee and ankle at 90 degrees. You may need assistance from another staff or parent to help hold the patient's foot in this position. Place the foot strip on the plantar aspect of the foot and up the Achilles, and begin wrapping the foot strip on the foot with 3 to 4 inch padding. Continue wrapping proximally, overlapping by 50%. Make sure there's no tension in the padding and simply lay the padding down on the foot. Being sure to keep the ankle at 90 degrees. It works best to do a figure 8 going around the ankle and back over the heel. Again, if you have a parent or another staff helping you, that will keep the foot from wiggling so much. My patient here is doing her very best to stay still. Continue overlapping by 50%, working proximally. Keep in mind, this is the first layer of padding. Lower extremity splints need lots and lots of padding. This will keep the splint from rubbing, creating pressure sores and ulcers, and make sure that there is no rubbing at the edges of the splint as well. Here I am adding that additional padding where the edges of the splint will be. We want to measure 2 to 3 finger breadths distal to the fibular head where the splint should end. This will avoid pressure on the common perineal nerve. Now we take the plaster roll and measure from one edge of the cast padding to the other edge of the cast padding. Plaster will shrink, so we want to make sure we have it long enough. Once I've measured, that piece of plaster becomes my template for the posterior slab. So I tear off and measure 10 to 12 strips of plaster. Now I measure the stirrup component, measuring from the edge of the padding on the medial aspect to the edge on the lateral aspect. This will now be my template for the stirrup component. So that will be 10 to 12 layers of plaster for each component. You would use 12 layers for an adolescent or adult. Keep in mind, the more layers of plaster, the more heat that will be produced when it sets up. If you don't have plaster, use fiberglass for these components. For plaster, use warm water to soak the plaster. Count out 10 thicknesses of the layers of plaster for each component. Put on some gloves and grab a hold of each edge of the plaster. Dunk in warm water. Squeeze out any excess water by holding onto the edges and using the other hand to squeeze out the water into a bucket or basin. Then use your fingers to grab the plaster in between and smooth out any of the wrinkles and also getting rid of any other excess water. You are trying to get those layers of plaster to become one thick sheet of plaster. Do this for both components. Apply the splint to the patient starting with the posterior slab. Take the foot strip padding and fold it back over the splint. This creates a nice platform for the bottom of the foot. Measure to make sure that the splint edge is just inside the padding. If it's a little long, you can fold the plaster. Remember, we want a good edge of the padding so the splint doesn't rub. Now apply the stirrup component. Same thing, when we look at the edges, we want to make sure that the splint does not go past the padding, that we've got a good centimeter or 2 of padding, and then the splint. Now I take my gloves off so as not to get plaster on everything else. And freeze! You should add one more layer of padding over the plaster, but I forgot. Begin wrapping the elastic bandage starting at the toes. Fold back the foot strip over the plaster splint. Using about 50% tension with the elastic bandage, we don't want to pull it too tight, so just about halfway. Again, you would have a parent or another staff member helping you hold the foot still while you are wrapping. Use a figure 8 to go around the heel and Achilles, then work your way down the calf. You will likely need another elastic bandage. Make sure to have that ready so you can keep going. If you don't have Velcro on your elastic bandage, a little piece of tape to hold the two together works well. As you get towards the end, make sure you have the padding and splint fully covered with the elastic bandage. Then you'll be able to cut off any excess and tape in place. While the splint is setting up, after we've placed all the tape, we want to make sure we keep the ankle at 90 degrees. Plaster takes more time to harden than fiberglass. Flip the patient over and place several pillows under the patient's calf. Check neurovascular status, sensation, cap refill. Make sure the ankle remains at 90 and pillows are under the calf, not the heel. This is so important to avoid pressure sores at the heel. The patient should know this when they elevate their leg at home as well. 2 tips for the patient to know to help minimize pain and swelling are keeping the foot elevated as much as possible and also using ice or cold pack about the knee or groin to interrupt pain signals going to the brain. 3 rules for the patient are listed below regarding every splint. All right, I hope that video was helpful for you. You can subscribe to the YouTube channel to be updated when new content is available. Also check out OrthoRefresh.com under the section How To for more videos with tips and tricks. We're also on Instagram and Facebook with the handle OrthoRefresh to find information on tips and pearls for patient care, provider wellness ideas, and fun. OrthoRefresh aims to be a tool in your tool belt as you care for patients. Thanks for watching.